The patient's condition is stable. A close contact has also been proactively placed in isolation. The caregiver and the family, as already stated, have requested total privacy, so we can't discuss any further details of the situation.
That is the Chief Clinical Officer for Texas Health Resources giving us an update on the condition of a healthcare worker in Dallas. It follows a major development here. A second person has been diagnosed with Ebola. The hospital employee was part of the team treating Thomas Eric Duncan, who died on Wednesday. Now, the patient is listed in stable condition. The worker had aided Thomas Eric Duncan in full protective gear. Duncan died from Ebola last week. Now, joining us for more on this is CBC's medical columnist, Dr. Peter Lynn. He joins us from Toronto. Dr. Lynn, we know that this healthcare worker, who is going to remain anonymous because that's what they've asked for, that person was following protocol and was wearing that CDC recommended gear. So the gloves, the mask, the gown. How could that person have contracted this virus then?
Yeah, that's the scariest part, is that he was wearing everything, or she was wearing everything. But the problem is how you take it off. So let's say I have my gown on, I have my gloves on, I have my protective glasses, so I do fine while I'm looking after the patient. Then when I leave that room, what do? How do I take off my gloves? That's the protocol that I think might have sort of slipped a little bit, because I was watching the U.S. Army as they were preparing. You know, there's certain ways that you're supposed to take off your gown and your gloves. And so you could imagine that if I've got contaminated hands, gloves, those kinds of things, it's the taking off of those equipment that might be the problem that we're seeing here, which is important for us to know, because it's not enough to put the stuff on. The most important thing is, how do I get the stuff off my body as well?
Okay, now the commissioner of the Texas Department of State Health Services says they knew that there would be a second case, so they were prepared for that. Is that surprising? Is that supposed to be comforting?
Well, it's surprising in the sense that it was somebody that had taken precautions. We were expecting somebody to get a second case in the sense of the family members. In other words, they didn't know that he had Ebola, probably would have been looking after him for those 4 days. So we were expecting that. Now, that may still come, because we're not past that 21 days of incubation. So we may still see a family member fall to this disease. And I know it sounds terrible, but if it was a family member that fell, we're not as concerned, in the sense that the protocols are working. Whereas in this case, if it was an ambulance member, even, for example, the paramedics that got it, basically, again, they wouldn't have known that he had Ebola at that time. Here, it's a little bit more concerning, because it was a healthcare worker that knew that the person had Ebola, had taken the precautions of putting on the gear, and still gets Ebola. And that's the real concern of this particular case.
And was also considered to be in the lower risk category out of the 50 people that they had asked to self-monitor, right? So where would we hear more cases coming from?
Yeah, so what we're going to be looking at now is they're going to throw that net around this person again. I think the family members are still at risk, because we're not past that time. The paramedics are still at risk. The first responders, or the first physicians or nurses that saw the person, would still be at risk as well. So that was where we were expecting the highest numbers, or if there is another case, to happen. Whereas in this case, having somebody fully protected in a lower risk situation, because he was sent home just to say, okay, self-protection. In other words, he had to isolate himself. It wasn't like he was a high risk where we had to move him somewhere. And that's the part where I think the CDC and everybody around the world is looking, how did this person get this virus? And what are the steps that we have to make sure that protocol is extended, so that we never have another case like this again?
Well, yeah, and we were hearing from the mayor of Dallas that was saying, you know, I want to reassure everyone as you wake up today that you are safe. Should we believe that, Dr. Lynn?
I think we are safe. It's safe in the sense that now everybody's on red alert. So what will happen is that they will review what this person did. How did they put on the gear? How did they take off the gear? What happened to the gear? What did they do thereafter? And by going through all of that, they may find that, let's say, the way they took off something was not proper, in which case then we inform everybody, hey, you know, it's important to make sure that this latter part, you know, getting the equipment off is the important part maybe. And that might not have been stressed in the beginning. So I think what will happen is, this is not an epidemic, sort of what we're seeing in West Africa. You could see that the CDC is very much on top of it. All the people are looking and monitoring themselves, which is the most important thing. And they're reporting themselves, because they're isolated already. And what we're hoping is that that dragnet of that 50 people or so that they were monitoring, that includes everybody. Now this net gets a little bit bigger with this particular person, but not by much, because right from the very beginning, he was already put into isolation as well.
Based on your medical experience, is there anything that was overlooked so far?
Yeah, so this is where we have to think about what other things were there. Did he forget, just touched his face or something like that, or her face? And basically, what we need to do is figure out what was the small breach that might have been happening. And if we could figure that out, I think that would be helpful. Even if we don't figure it out exactly down to the exactly this is what the person did, I think everybody in Canada and the rest of the world are going to take extra precautions now. They were on red alert already. Now it's red alert plus, 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 meaning that not only will we be careful screening patients as they come through the door, they will definitely be looking after how do we get rid of anything that's been contaminated by this potential Ebola virus anywhere. Now, in Canada, we've been very well prepared already. And so hopefully what this will mean is that everybody will look at their own protocols again within their hospital and then rerun these training programs that they've been doing to make sure that the people are taking off the equipment with as much care as putting the equipment on.
All right, appreciate your insight, Dr. Lin. Thank you.
Thanks, Rashmi.
Dr. Peter Lin, CBC's medical columnist, joining us from Toronto.